Hi, my name is Martin Purnell, and welcome to Off-Grid Christianity, a weekly podcast for those who go or don't go to church and where we can meet and hear from those that have made their faith count. This podcast series is to encourage via conversation, and you can contact us as well by email, ogc@accessradio.biz. That's ogc@accessradio.biz. So welcome to today's special podcast, this time on the subject of abortion, a guide to making decisions. It is not, I repeat, not one of those podcasts where Bible verses are thrown almost at will regarding this subject. Together with two co-authors, today's guest wrote Pregnancy and Abortion, a practical guide to making decisions. It is a book that is to have a re-release with updates very soon indeed. He is a returning guest and until 2014 was a GP in Sheffield, but retired early due to physical ankle pain. Happily, now all okay through an operation or two. In episode 156, our guest discusses his life to date, plus his recently published biographical book about a Royal Naval surgeon who saved two admirals' lives during World War II. Having read the book myself, I can confirm it was meticulously researched and well written, and the surgeon concerned just happened to be his dad. In episode 156, we briefly touched on his pregnancy and abortion book. We agreed that a special podcast would be beneficial for those who would like to know more on this subject, hence this episode. It gives me great pleasure to welcome back Dr. Mark Houghton. Mark, thank you so much for joining us today. In episode 156, they'll find out a bit more about you and about Sheffield, where you live. But for those that know nothing about you at all, sir, how are you physically these days?
Oh, hello, Martin. It's very good to be back with you again on this lovely spring afternoon. I'm like walking on air. It's like living on another planet because I've had chronic pain either in my back, my legs or my ankles for 30 years,
Wow.
Actually 31 years last year. Yes, I've even been skiing this year because I've had both ankles operated, one last year, one the year before, with very good results. And I'm very grateful. As a Christian, I see it as a great answer to prayer through very skilled surgery.
Wow. And you
Wonderful.
didn't do it yourself either?
I didn't do it myself. No. Last week, I said to my son, who's about 35, I said, watch this, Dan, because you're going to see something you can't remember ever seeing. I walked up the other end of the garden and then I ran towards him. He can't remember me running.
Wow.
So that was great joy.
Wow.
We had a real hug when I got back to the house on my run down the garden.
Is he in the medical profession as well?
No, he's an engineer and he used to make and sell surgical instruments. So we've got that very much in common.
Yeah. As far as the subject is concerned, what do you think are the aims and objectives of today's podcast?
I think I'd like to, in a very gentle way and without dumping a load of guilt on anybody, just open people's eyes to what is really a huge problem in our midst as a nation and as individuals.
And the way that we'll be doing it is by me asking questions, listening, and then hopefully I'll be able to come back with some more questions on behalf of the listeners of what they might like to ask you so that they can get a more of an informed picture. I did say right at the very beginning that it is not, I repeat, not one of those podcasts where Bible verses are thrown almost at will. Would you rubber stamp that?
Oh, yes, absolutely. I mean, let's be upfront. I am a Christian, but I trust and pray that has made me a better doctor over the years. I'm also not without blame in this area. I've been involved in one abortion, which I deeply regret now. So let's remember right at the beginning that abortion is not the unforgivable sin. It's very powerful for causing guilt. Maybe for obvious reasons, but perhaps we can touch on that a bit later. But this is not a guilt trip this afternoon. This is seeking a way forward for people with problem pregnancy, people who've had abortions, people who've been involved in abortion and wish they hadn't. So that's where I'm coming from. That's where we'll be going. And it's good to remember, if you, the listener, are wrestling with shame and guilt in this area, the wonderful words in the Bible that there is no condemnation for those who are in Christ Jesus. As I say, I had to bring an incident, a clinical matter, which I was involved in, to the foot of the cross and say, Lord Jesus, I wish I hadn't done that. And gradually, over a long period of time, he did take away that sense of condemnation and guilt. And I've learned so much from it. And he's actually, despite that regrettable clinical incident, which I was involved in, he's, I believe, used that to help other people.
Mark, I think I'd like to suggest right at the beginning with regard to the importance, or maybe not, the important role statistics play, because no doubt you'll be talking statistics throughout the course of this podcast. But for a more detailed analysis, I take it people will be able to find them in your book. Would that be a fair comment?
Yes, it is a fair comment. It's written for non-medical people to read. So I've tried to keep the language simple. The second half of the book, you don't have to read at all if you're trying to deal with a crisis pregnancy. There's a lot more detail into the statistics in the second half of the book. I've tried to make it plain and simple in the early chapters, where perhaps a woman who's in a crisis situation wants to go through it all quickly. But for people who want to dig deeper, the last half of the book is called Digging Deeper, and you can look into the evidence for and against the complications in more depth there. I should say, while I've taken every effort for accurate information in what I say this afternoon and in the guide, that this is not a substitute for personal medical advice for anyone. Anyone seeking advice should consult their own medical practitioner in matters of health, and specifically with respect to any symptoms that may require diagnosis or medical attention. And before any form of medical treatment, you should always consult your personal medical practitioner. Of course, things are changing all the time, so information can get out of date quickly. Let's remember that as we have this discussion.
So just to clarify that, then basically, when you talk statistics and you might not give an actual figure, quite often they'll be able to find it in the book if they want an exact figure.
Correct. Good clinical care is based on statistical probability. So after some unhelpful operations on my back, well, particularly my ankles, when another surgeon came along and said, I can help you, I looked at the statistics very carefully because I didn't want to be made worse than I already was. And when I researched it and discovered that there was a very good track record with the operation proposed, then I decided to go forward. Whereas when it comes to the role of termination of pregnancy as a treatment, I think the statistics are much more worrying.
We'll no doubt talk about that later on. Thank you. Just to get a bigger picture then, why did you want to co-write a book on this subject in the first place, Mark?
Well, I've been involved with it since I was a medical student. I'll never forget my first abortion that I was forced to go and watch. And it looked such a horribly, just a mechanical process. The doctors didn't seem to have any relationship with the patient, and it was rather grim. And so by my middle age as a doctor, I had seen or been involved pre, during and post-abortion with many, many women, couples, men. And I came on research, and this is where the statistics come in, that the safety record of abortion in good hands, this is not talking about dirty backstreet abortion, this is ordinary, best quality care abortion. The safety record was disturbing. So I began to look into it and got even more disturbed. I was already disturbed as a Christian because God is always trying to preserve life, and most doctors want to preserve life. Nobody goes into medicine to destroy life. Well, I can't think of anyone who would anyway. And yet that's what the profession was caught up in. So in my middle years, and perhaps the last third of my professional life, I began to question, is this really good medical care? And the General Medical Council has very strict, and very rightly, very strict demands on what constitutes good medical care. And if you're going to harm the patient, not help them, you have to question very much why should we be doing it at all.
Well, let's go for it then. And start with, you've mentioned couples, women and men. How informed are these people on the subject of abortion when they first go and see, say, a GP or a health clinic? How informed are they?
Well, I would say, first of all, that I've never met a woman who's come to me with any sort of early pregnancy who doesn't know in her heart and will often say, this is a living human being that I'm carrying. and they will treat it as a baby, as most people would treat that word. Sometimes we call it pregnancy or things like that to sort of dehumanize the situation. But everybody knows exactly that this is another human being. It's not the woman herself. She knows that. Yeah, I think there's a sort of vague knowledge about the mechanics of perhaps taking the pills by post, that you get these two pills and you have the uterus expels the baby or the pregnancy at home, or could be anywhere, actually. I think most people have a vague idea of that. I think that's about where it ends. I guess many people will know that surgical terminations are usually done in a clean operating theatre with a sterile technique. And they're probably completely unaware that even doing that it's common for infections to get in, particularly if you've already got known or unknown a sexually transmitted infection, an STI. So I think there's a grave amount of just not knowing in the general public. And this is what really shocked me. I found there's a grave amount of not knowing in the medical profession. That's why it was so difficult to get to the bottom of the information. And that's why I put it all into a simple, easy to read book where you can find where the evidence came from. You can see that, for instance, immediate complications are very common. 1 in 5. These are the sort of things when you open your packet of paracetamol and you think, I'll just check what are the side effects. It's all graded into common, uncommon, so on and so on. But this is very common that you will have some immediate complications of abortion.
We'll talk about that later on then. Thank you. You mentioned you're Christian, as am I. People might not want to buy this book, though, especially if they're listening today and they're not Christians themselves, because, you're going to have a Christian perspective on it. It's going to be slanted towards your certain bias. How true is this statement regarding your book?
Yes, obviously, I am informed by my faith and by the Bible and by the teaching of Jesus Christ. But that's not mentioned in the book. I've never had a complaint about this book from any non-Christian over the years it's been in print. And I haven't had any complaint either about the statistical evidence on the side effects which are quoted. Statistics can always be criticized. Did you study that paper or that scientific report? But I've done my very best as a Christian to be honest and to get the best quality information to the general public. That's the point of the book. Just to say, Martin, I should just go back to your last question about is the faith in the book? Well, no, it's not. It's not a moralizing book. It's a book to help people make decisions based on good medical evidence. So it's not a moralizing book. But at the end of the book, there are 2 appendix chapters on what different faiths believe, including Christianity, Islam, Hinduism, Sikhism, and so on. So the General Medical Council says that doctors should take into account the religious or personal beliefs of patients. So that's the only time that faith is mentioned.
Let's go back to 1967 when the Abortion Act came into being. What do we actually know as to why the Abortion Act came into being in 1967 and not before, or even later in some countries?
Yes, abortion in Britain had always been illegal, partly because it's a dangerous thing to do. As I said earlier, whether you're doing it under perfect sterile conditions and so on, infections still get in and complications happen. The Act came in 1967 after some years of vigorous debate. The churches were rather silent at the time. They seemed to not have a great view.
Really? Okay.
The big argument that was bandied around at the time was we ought to do abortions in proper hospital settings because people were looking for backstreet abortions or even self-abortions, which were a lot more risky, which of course they are. There's been debate over the numbers, but in view of the fact that it was a few thousand compared to now 250,000 abortions a year.
In the UK?
In the UK, I think the risks of abortion now are far, far greater than they were in the late 1960s when it became law.
Tell us more about that.
I think there was a need to regulate the matter clinically, because there were rare occasions when doctors needed to do abortions and not to be under threat of the criminal law. So an act was drawn up, the 1967 Abortion Act, which permitted abortion in certain situations. And the clause that's been used, not exclusively, but in 98% of abortions ever since, from 1968, when the act became law, until now, is that if we don't do an abortion, the mental health of the woman will become worse. In other words, having an abortion will improve her mental health. That was a very wishy-washy clause. And at the time, the psychiatrists, I've read reports of psychiatrists saying, we can't think of any grounds where abortion will help the mental health. So from the early days, it was known that abortion might actually worsen the mental health, which is basically what we now know from worldwide studies, that you're more likely to have your mental health worsened by abortion than helped. It was an act that was very much open to interpretation. It's a very important law because it's the only place, apart from the police, where two medical doctors can sign away the life of another human being. And not surprisingly, there's strict laws around that.
It's interesting, isn't it, that you call it a human being, but when we hear from the powers that be, they don't actually say the baby, do they? They call it another name.
Call it the embryo if it's early on, or the fetus. Those are appropriate names, but they all describe another human being. There is no other law. We don't have a law of capital punishment anymore. One of the reasons that was abolished was that people were being put to death who shouldn't have been under the law. We have exactly that situation now in Britain for the vast majority of abortions.
Before we go into abortions that can go seriously wrong, for instance, septic abortion, because many people might not know what a septic abortion is, so you please help us out on that. I remember, in the late 1990s, getting a postcard, and it talked about, I think, just over 100,000 abortions were done in the early 1990s in a particular year, of which I think less than 20 were because of rape. So work out the maths on that one. There were a lot of abortions that weren't done for that, maybe a few also as well for medical reasons. What is the number one reason, do you think, for people wanting to have an abortion these days?
I think all through my medical career, and I've been taking, since I was a medical student and then a junior doctor, I've been taking the histories. I think it's basically convenience. It's a convenience treatment.
Holidays, for instance.
Yes, the first woman I remember looking after as a senior house officer in a certain hospital, I said, well, why do you want an abortion? She said, I've got a holiday booked. And I was rather stunned to hear that. In fact, the process was done and there was complications in that she just continued bleeding afterwards. The process of dilating the cervix and getting instruments into the womb can introduce infection. It can also tear the cervix and the womb, and it disturbs things hormonally. So for some reason or other, she was bleeding, and she was trying to hide the pregnancy from her family. Her boyfriend knew about it, but no one else. So my consultant told me to say she'd come in to have a D&C for heavy periods, which was a lie.
The D&C being?
Dilation and curettage, which is a scrape out of the womb for women who have heavy periods. It's one of the treatments, particularly used to be. And then she had one, I think first one, then another D&C scrape, and the bleeding went on and we couldn't control it. So we started giving her powerful hormones, and the web of secrecy, with increasingly worried mother and father coming in to see what was going on, was awful, really. This was one of my early cases, and it marks me very much. I remember coming in to the ward one day and looking at her, and she had turned her face to the wall and was staring with a look of utter despair. You see, the thing is, you can't invade a woman's body and remove what is the most precious thing in her body at that time. Hormonally, it's the most precious thing. The whole body is striving to keep the baby in and to nurture the child. You can't remove. It's sold as a sort of simple solution. It's a very, very complex solution, and it always impacts the woman greatly, whatever they may say.
Right. I'd like to come back to that in a minute. I said just a few minutes ago about septic abortion. What exactly is septic abortion? What other illnesses can we say come from an abortion?
I would say septic abortion is a rare but deadly complication in the early days after an abortion. We've already said that some infections will get in. Mm-hmm. They're quite common, and they can cause problems of fertility and pain for years and years afterwards. Septic abortion is where a major nasty germ gets in and within hours is threatening the life of the patient.
Statistically, how many septic abortions are there, do you think, a year?
I've no idea, but as I say, it's a rare complication, but you will see in every hospital big signs up about recognizing sepsis, because abortion is just one of the causes of it. That's not backstreet abortion. That's normal, clean abortion. And the patient may be very pale. They may be have a very fast pulse rate. They may have a high temperature or even a low temperature. They may be shocked. In other words, they literally can't stand up. And they may even have that sense of, I'm going to die, and call for help. Any of those things, you should take immediate action. Don't wait for tomorrow.
If it's very rare, people's going to say, oh, well, that's all right. The chances of anything happening to me, 99%, I'll be fine. What other illnesses can be attributed, though, to having an abortion?
The early complications are, I think, the emotions are the first one I would mention, where initially there's often a feeling of relief that the deed is done and that, in theory, the problem is out of the way. But then there can come, even the same day, a devastating plunge and into emotional despair because people realize the finality of what they've done. And there's no turning the clock back. Mm-hmm. Heavy bleeding, which I've just mentioned in that sad case, you can expect bleeding and blood clots for 10 days afterwards, but it can take much longer. So everyone going through this has to stock up with a lot of sanitary pads and keep count of how many they're using, because this can help the doctor to know whether a blood transfusion might be needed later, along with antibiotics. And then the next complication, which has hit the headlines a few times with so many pills by post and telemedicine abortion going on, is that the bleeding doesn't stop, the pain doesn't stop, so they come back in and they have to have surgical intervention. There may be still retained products of conception. In other words, parts of the fetus, parts of the placenta are still inside the uterus or the birth canal, and they have to be removed surgically. And then surgery itself can tear the cervix so that in later years, you are more prone to lose a baby by premature birth or stillbirth. Then the uterus itself can be punctured. So all medical interventions carry risk. You can't do these things without risk, however well meant it is.
But gun statistics, for those thinking, oh, yeah, it's not going to happen to me, all those things that you just shared, which obviously paints a very vivid picture certainly into my mind, as what could possibly go wrong. What are the chances of just sailing through, for instance, and everything's going to be all right, statistically wise?
Well, any of the overall short-term complications during or immediately after, in the first few weeks after an abortion, they tend to affect about 1 in 5 women. So it's pretty common.
Right.
Other complications are that occasionally, very occasionally, but it does happen, the baby is born alive. And then you have all this conflict over, are we here to save life or to take life? I heard of a case yesterday where I think it was quite a late abortion and very much a recognizable baby. And the child was crying, and the skin had been damaged and was coming off in sheets. And the surgeon didn't know what to do. And he spoke to a friend of mine who I was talking to yesterday. And the surgeon said, I will never, ever, ever do an abortion ever again after that.
If that surgeon then killed the baby, that'd be murder, wouldn't it?
Yes, basically. Yeah, you've got this complete madness in the law where if the head of the body of the baby are inside the woman still in some way, it's legal. Whereas born alive and killed, it's murder.
So what happens to the little baby?
I think it all depends on who's present at the time. They used to keep the statistics of babies born alive in British hospitals, and the last year that they published their records, it was about 66 children. And of course, some of these are alive today, and they've spoken up for the rights of the unborn. I think sometimes they die because they're very premature. Mm-hmm. They can't be resuscitated. Sometimes they're rushed to neonatal intensive care, and everyone is thrown into total emotional confusion.
What do we know about the statistics today currently as to how many women have abortions because of rape?
I think the numbers are quite low, but when I did some research on this, what I did discover was that most women who've been raped and conceived, they would rather keep the baby. Abortion is meant to solve a problem, mm-hmm. but how does abortion solve the problem of rape? Well, you could argue it gets rid of that reminder of the terrible thing that was done to the victim. And I know some Christians have argued it that way. But I remember working in a poor part of Sheffield, and a woman came in from the women's refuge. She had another child on her arm already. She was looking after someone else's child, and she stood because she was in a hurry with children of her own. And she said, I was raped and I'm pregnant. And I felt terrible shame to be a man, frankly, mm-hmm. because a man had caused her problem. And I just couldn't think what to say or do. So I reached for the pad of legal abortion forms and decided I would have to sign it. The second time in my life I would have ever signed such a form. And she saw me reaching, and she saw the official sort of government stamp on it and said, don't you do that. What wrong has this babby done? So I felt instantly guilty all over again for the opposite reason, that I hadn't defended the child that she was carrying. And she said, I'm not going to have an abortion. Oh, no, I'm not. This babby hasn't done anything wrong, has it? And I guess it hasn't, has it?
No. What stats are there from the people who had abortions, let's say, back in the late 60s through 70s and 80s, and they could actually say today on this podcast to give the alternative viewpoint, well, I'm fine health-wise, look at me. So what stats are there to say that people who had abortions 30, 40 years ago, they're fine today as a result of an abortion?
Oh, I think there's a lot of women. When you look at the population now, you look at any gathering of people, it's now about one third of women and 1/3 of men are using abortion. It's a lot of people. The numbers were less in the early decades. You know, they climbed rapidly through the thousands after the legalization of termination of pregnancy. What I found, because, you know, when you sit down with the patient, you see their medical record. And if there's been a termination in the past, it's usually on there. And I would sometimes just go down the record of all the sicknesses that a patient has had, mm-hmm. including unwanted pregnancy. And I found that I think regret was the chief thing that they mentioned. Very commonly, I would hear, oh, I think of that child every day of my life. If I could turn the clock back, I would. It was the right thing. It seemed the right thing at the time, but it's just as real now as it ever was. Those are the most common responses I got.
Mm.
So there's a great conflict that goes on in a person's heart, deep down in their soul. And I've known women, old women, who must have had abortions way back when it was just legalized, or even I remember some of my early patients long before it was legalized, and might have been done at Harley Street. I remember one woman said, I had it done in the 1930s by a consultant in Harley Street. So obviously it was done well, but as far as we knew, there were no physical consequences. Although I remember finding out with that lady that she had no other children. So that is one of the consequences. I'm not saying it was necessarily caused by that abortion, but it might have been. We can come to that later.
Yeah.
The trouble with her was the awful, compelling guilt that she carried from the 1930s to the 1980s. And she put her hand on mine, and with a face full of lines, it looked like the Himalayas, a relief map covered in lines. She said, Doctor, can I ever be forgiven? And I said, yes, I'm a Christian, and Jesus came to take away our sins, and you can be forgiven. And to see her face, no member of the General Medical Council could say I had done anything wrong, because those lines just drained away and a huge smile came on her face. And she said, I feel relief after all these years that I am forgiven. So that's the guilt and shame that goes with abortion.
On the other side of the coin, I do know a friend of ours, she had an abortion, and that was because she was raped by a relative many years ago, and had to then leave the town, so say for a holiday, come back. And she was quite happy to tell me that she doesn't have a problem at all with abortion. But it's something you said that really struck a chord with me, that as a bloke, I would not understand this really. But when a woman becomes pregnant, there's suddenly hormonal changes, but your body all of a sudden is making chemicals, I would have thought, like you're suggesting, to just help the baby grow so it can be fully delivered. So if that's the case, and you take an abortion, there could be, I suppose, an abnormal reaction to the body. What do we know about that? And what has it proven in years ahead regarding what the body actually does?
As you say, when conception happens, within an hour or so, the fetus, or it's at that stage called an embryo, but it is a complete early human being that will turn into a fully formed human being. Within an hour or so, HCG, human chorionic gonadotrophin, is sent out from that single-celled embryo. And this tells the woman's body to get going. We're heading into a pregnancy, prepares the woman's body and mind and emotions for growing a child over the next 9 months. So immediately there's a signal comes from the single cell embryo that I'm here and let's get on with it.
If that's the case, then I suppose, in 9 months' time, that the body will know the baby's been born, so it can go back to its previous state. But if you have an abortion, how does the body know, and might still continue making whatever it was making as if it was still going on for a proper pregnancy?
This is where the strong connection with breast cancer later on comes in, because you see, you were asking earlier, do those people who had abortions, decades back, are there any consequences? Well, the rising cases of breast cancer in the UK population may very well be related to previous abortions, because you can track the rise in numbers of abortions. It's an upward going graph. And a few years later, you can track the same level of climb of the line on the graph for breast cancer. And a lot of statistical research has been done on that. Whereas in Ireland, which did not have abortion until very recently, the breast cancer line is much flatter, which shows the protective effect of having a child for the woman is there. It's very real, and for other conditions as well, not just breast cancer. Now, the reason why removing the child, say at 12 weeks pregnancy, removing the fetus at that stage, by then a lot of hormones have gone round and the woman's breasts have changed. Women quite often notice breast changes in the very early weeks of pregnancy, and they go through a state of being cancer safe until around 12 weeks, they are cancer prone. Now, if you remove the pregnancy, the fetus at that point, you leave the woman's breasts in a cancer risky state for the rest of her life.
How come?
Because the breast cells in a woman are being prepared to produce milk and feed the baby for some years. But the preparation goes, as I say, from a cancer safe state through to a cancer risky state. And then in a normal pregnancy that goes to 32 weeks or more, 32 to 40 weeks, the breast goes back to a safe state and it stays in an even safer state than if you'd never been pregnant.
Really?
Yeah.
Okay.
This is a well-known biological fact. And this is why this is another pointer to the strong connection, some people would say causation, between having an early abortion and later breast cancer, that there's a direct causative effect. And that's part of the evidence for that.
Well, let's go into that bit more detail then, because that is quite a statement to make.
Yeah.
Are we saying that if you have an abortion, you are severely likely to get cancer or moderately likely to get cancer compared to someone that doesn't have an abortion? Where do we stand on this?
I think I would say there's a moderate increase in risk of cancer. And this is hotly disputed by the abortion doctors because, of course, they're making money out of it and they would prefer this not to be true.
But you could back this up. I'm just thinking that if the GMC, General Medical Council, listens to this podcast and they oiks you up into a courtroom to say what you're saying here is inflammatory, blah, 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 would you be able to prove statistically that this is the case?
Oh, I tell them to read the chapters in my book. Yeah, there would be a big argument. But this has gone to court in America and Australia in over 20 cases where patients have blamed the doctor who did the abortion for causing their breast cancer. And the cases have been won because the scientific evidence for the link between abortion and breast cancer has been accepted by the juries in both the United States and at least 3 cases in Australia when I last looked into it. So when you put the evidence to a panel or a jury, they say there's enough evidence there to make that causative link.
If you had to put a stat on it, 1 times, 2 times, 3 times, 4 times, 5 times more likely to get cancer if you've had an abortion, would that be a fair question? What would it be?
I can't give the stat to that, but what I can say is that do all you can to have a first full-term delivery as early as possible, because it's been known for decades that the age at first full-term delivery, that's you get pregnant and the baby goes through to term and is delivered, that sets your breasts into a safer state for the rest of your life. And of course, the second effect, which is beneficial, is that you may breastfeed the child. And breastfeeding is well known to be protective against breast cancer. None of these things are absolute, but if you want to keep your breasts in a healthy state, then allow your first full-term pregnancy to go to term.
Yeah, we often hear about that, don't we, about breastfeeding versus bottled milk feeding. But I do like statistics, and I do want to find out how these stats can be made whereby, well, it says how many people got cancer where compared to somebody, to a country or whatever, that haven't had breast cancer in women. What can you say, well, this will help in the argument that it actually is the case? Well,
it's not new science. It's been known for hundreds of years because they studied the nuns.
Really?
In Italy. Back in the Middle Ages, a chap noticed that the nuns were getting more breast cancer than the village people who were marrying and having babies. This is settled science that if you remove pregnancy early or a woman who's never been pregnant, unfortunately, they are at a higher risk of breast cancer. And what I've just mentioned already, the key factor of the first full-term delivery, FFTD, that's the critical factor for the risk of breast cancer. So the best thing you can do if you get pregnant for whatever reason, for the protective effect against breast cancer, is to allow the pregnancy to go into the 3rd trimester.
For those that are listening today who had a repeat abortion, are there any statistics to show that, if you've had one abortion, you can have another one, and subsequent health should be all okay.
Unfortunately, repeat abortions are not good news. Take the situation with premature birth. There are various reasons why a previous abortion should cause premature birth in the pregnancy that comes next. There's damage to the tissues that we've already talked about, the cervix, the uterus itself. So yes, there is a link between previous abortion and premature birth. Now, it's obvious that a baby that's born too early is at greater risk. And there's growing evidence. I'm aware of a huge meta-analysis that's being prepared at the moment. Studying a meta-analysis is where you study all the studies and you pool all the data. The evidence from around the world of good quality studies is that preterm birth is more likely if you've had previous abortion. Your risks double, roughly speaking, if you have 2 abortions. And this is a serious form of preterm birth. It's not that the baby is born 2 or 3 weeks early, which would normally be fine. This is babies born at extreme prematurity. That is the link with previous abortion. So they'll be born when they're 22 weeks, 24 weeks, 26 weeks, at the very limits of what we can do to keep a baby alive. I used to work in neonatal intensive care, and I know the challenges are very great. And in the best possible hands, you can't really keep a baby alive outside the womb that's younger than 22 weeks from gestation.
There's always the odd case where that's actually happened, isn't there?
Yeah, there are cases from 22 weeks, but they're at high risk of bleeding in the brain, of respiratory problems, breathing problems. Now, those extreme prematurity, those are the ones that are linked with previous abortion, sadly.
As a matter of interest, the young lady you talk about, what do we know of her? What happened to her in the end? Do you know?
Well, she was a hospital patient, so I don't know what happened beyond that, except that what I do know is that mismanagement and dishonesty by me and my profession have basically damaged her for life.
Could she sue you if she wanted to?
No, I don't think so, because it was a long, long time ago, and people are not thinking that way. They are in America, but in Britain, there's been this tender trust of doctors that we know what we're doing. Whereas time and again, I find when I present the evidence from this collection I've put together in the book, Pregnancy and Abortion, A Practical Guide, that the doctors don't know this evidence. I was talking to a very senior obstetrician, a professor. I took him out for lunch from a centre of excellence, not Sheffield, but not a million miles from Sheffield, a centre of excellence known all over the world. And he didn't know about the mortality figures, that the woman who has an abortion is 2 or 3, or some figures say 4 times more likely to die in the year after the abortion than if she had had the baby. And he didn't know that this has been studied in Finland, Denmark, not just with a handful of women, but with a whole population of women, because they've got excellent medical records. And you can find out, you can look back and see all the women who had an abortion, and then when did they die? And there's this clear association between a higher risk of dying young than if you had had a baby. Now, it's counterintuitive. Most of us think, if you just have a quick abortion, simple and safe, you just get rid of it, that will be less dangerous than going through 9 months of pregnancy and having a baby and birth, which everyone knows has its risks. Well, actually, the evidence is that that's less risky. It would be safer to have the baby in terms of threats to life and dying young than having the abortion. This leading clinical professor of gynecology didn't know those studies. I was astonished, but that's what I find. I think this is one of the most extraordinary medical ignorances or cover-ups. I've never heard of anything so widespread and so deep as this problem. And I know colleagues of mine, we're trying to work to correct it, but you meet tremendous opposition. It's very like the days when people were trying to show that germs are spread through dirty hands, because surgeons in the 19th century used to operate with no gloves, and then the germs would be spread into the patient, and infection and sepsis was very common. And the chap who tried to bring in sterile rubber gloves was ignored in the corridors of his own hospital. And now, of course, it would be known to be ridiculous if you didn't use sterile technique. But there was such an entrenched opposition, such a pride in the heart of the profession that that information didn't get out as quick as it could have done. And I think we're living through a similar intentional blindness in our profession now, except it's probably far, far worse.
So this obstetrician that you took out for a meal, there must have been an ulterior motive for you to do that.
I took him out because I wanted to know what a typical expert from a centre of evidence thought. I'm not an academic. I'm just I was an ordinary GP. So that's why I took him out for lunch. And we had this interesting conversation. I wanted to know what he knew. I'm a totally unknown doctor, that's been looking into this with the help of a few friends. Why isn't it mainstream? Well, there's entrenched financial incentives that it should not be known about. There's a huge industry devoted to helping women to get rid of their pregnancies. It's not difficult to see. And then, of course, when a third of the population has used this technique, people are they're just not ready to think that actually it could be bad for women. Most of us can see that it's not great for the unborn child. But what about the women? Sure, it's safe for women, isn't it?
Mark, thank you for what you've shared so far. Just got time for 2 more questions. If people would want to buy the new edition that's coming out shortly that I mentioned at the beginning, how can they? And what about the previous editions? Where can they get those from, please?
The second edition came out in 2020, and most of that remains true to this day. That has got the pathway in it where you can, if you are pregnant and you're trying to work out what is the best thing to do, and you want to sort of look at what we were saying, the problem behind the pregnancy, the problem that the pregnancy throws up, you'll find a counselling pathway that you can work through yourself in that book. And then you will also find sections on the side effects that you need to be aware of in order to make truly informed consent before signing for an abortion or not. In the next few months, we are working on a much shorter version of those books because they're quite full books, the first and second edition. So we're bringing a shorter one out for the woman in crisis. The first and second books are extremely useful for doctors, nurses, pastors, counsellors, anybody working with pregnant women. It's called Pregnancy and Abortion, A Practical Guide to Making Decisions by Mark Houghton, Esther Lüthy, and Christine Fidler.
And finally, should anyone want to contact you, how can they do that?
Could they possibly write through you?
If they write to ogc@accessradio.biz, B-I-Z, yes,
great.
We can certainly pass it on to you. Mark, thank you so much for what you shared today. Hopefully we have achieved our aims and objectives to give a practical guide to making decisions on this subject of pregnancy and abortion. And as I said, if anybody wants to contact you as a result of this, having bought the book, obviously, which I know is also available through Amazon, please read the book. But if they want to get hold of you, they can. And the address again is ogc@accessradio.biz.
Yes, thank you, Martin. It's been a pleasure to join you on a very difficult subject, and I hope it's of value to the listeners.
Thank you for joining us today. Cheers, God bless. And if you haven't already hit the like and subscribe button, please do. Next time on Off-Grid Christianity, well, I'm glad you've been wrestling with God, because I've wrestled with God all my life and haven't even won a round yet. So how close were you to winning a round?
The closest I got to really feeling I was wrestling is I had a couple of miscarriages before my son was born. And then with the third pregnancy, I had a little bit of bleeding and, was worried. And I do remember wrestling, like really wrestling through the Psalms and praying to God for about an hour. When you just have that, you're really caught up with the Spirit. And I don't think I've ever had it for such an hour long. I have moments like that in worship, maybe for a few minutes. Mm-hmm. Yeah, I don't know whether I won. I don't think we can beat God, but I definitely felt like that period of intercession was I mean, I wasn't bargaining with God, but really just wrestling for this unborn baby that I had. But in hindsight, again, those 2 miscarriages that I had prepared me for suffering, or to understand suffering and how it is unwarranted. So when Eileen asked me to care for these women that were suffering, and these impoverished women, I knew firsthand, and I was in that place of knowing that suffering is so unwarranted. And God is asking us really to be his hands and feet.
So please join me with special guest, author and charity founder of Women Without Roofs, a charity to help impoverished women in Nepal, Anna Townsend. What an amazing lady. Until then, cheerio.